I do want to thank the folks at St. Mary Medical Center for doing some very innovative work, including Lisa Kelly, who is the lead for the community benefit activities at St. Mary Medical Center in Bucks County, Pennsylvania. St. Mary recognized the health impact and the cost of 3 major chronic diseases and their related risk factors, particularly looking at the all-cancer rate, the heart disease rate, and the stroke rate. Here's what the data look like. As you can see here from this 3-color gauge, the all-cancer incidence rate is quite high in Bucks County. In comparison to all counties in the United States, it's in the worst quartile, and over 500 cases per 100,000 population are due to cancer. Next, we can take a quick look at the age-adjusted death rate due to stroke, and we see that Bucks County is also in the yellow and faring worse than many counties across the United States. Taking a closer look at the population in Bucks County, we recognize that the St. Mary population or service area, if we look at the poor versus the non-poor groups, we see starkly different rates of occurrence of both the chronic disease, some of the chronic diseases I mentioned, as well as their associated risk factors. In many cases, these rates are double or triple amongst the poor population in comparison to the non-poor population. And this is vitally important information in terms of directing the prevention efforts. What did St. Mary's come up with to solve the problem? Well, they went to the Healthy Communities Institute Promising Practices database and found a very top evidence-based solution. That's Chronic Disease Self-Management Program. All of that information is written up here. This is a screenshot from the web page. They evaluated a number of different programs, but decided on the Chronic Disease Self-Management Program, which grew out of the Stanford Patient Education and Research Center. All of the contact information was available to Lisa Kelly at St. Mary's, and so she followed up and learned more about the program and decided that it was a very good fit for St. Mary's. Although Bucks County does not have a large Spanish-speaking population, I thought that I would point out as well that this very top evidence-based program has also been adapted for Spanish population, and some of the impressive results that you'll see have been replicated amongst the Spanish-speaking population. So there's many different populations that this particular evidence-based solution can be applied. What did St. Mary's do? Their strategy was to initiate 7 chronic disease self-management programs. Each of them enrolls approximately 15 participants. They also instituted 5 diabetes self-management programs, and they worked with a number of partners to make sure that they could find those poor residents that are suffering with chronic disease in Bucks County. They worked with care management, they worked with senior centers, they worked with the Bucks County Area Agency on Aging, the St. Mary's Diabetes Education Center, and Langhorne Physician Services. What are the benefits of the program? Well, reduced utilization and admission through prevention. They use the Healthy Communities Network, as I mentioned, to identify chronic disease management as a key issue, and the evidence-based program to resolve that issue. The year 1 successes from the St. Mary program is that of their program participants, they are confident to self-manage their condition, rated themselves 8, a mean of 8 on a scale of 1 to 10, and the programs have been enormously popular, with 10 additional programs being implemented due to the wait lists for the first set of programs. I'm going to share with you now some data that is not specific to St. Mary's, but it is included in the national follow-up study that was done to look at the efficacy and impact of disease self-management education programs from Stanford. So a sample, this is from a national sample of the participants conducting disease self-management, including St. Mary Hospital's data here. And we see some pretty impressive outcomes. Those individuals participating, the percentage with emergency department visits in the past 6 months dropped from a mean at the baseline of 18% down to 13%, statistically significant. The patient health questionnaire on depression, just self-administered by the participants, showed that there was also a significant improvement from 6.6% depression to 5.1%. That's a 21% improvement. And also unhealthy physical days, self-rated over the last 30 days, participants went from 8.7% feeling they had unhealthy days to 7.2%, and that represents a 15% improvement from baseline. The financial impact of these outcomes really adds up. At the cost, these preliminary results, at the cost of $740 per person savings in ED usage and hospitalization utilization, there's actually savings, a net savings of $390 per person after we consider the program costs. But these costs are not insignificant when we look at the number of people in the United States that suffer from a chronic disease and need assistance in managing that condition. It's extrapolated that reaching only 10% of Americans with one or more chronic conditions would save approximately $4.2 billion across the U.S. So I just want to give a huge congratulations to Lisa Kelly, Head of Community Benefit for St. Mary's, for doing something really tangible that is improving health and reducing costs.